So being a doctor was always a dream for me and for my family. I still remember that when I was in my second year and we had our clinical postings. So that was the first time I saw normal delivery in the labor room. And somehow seeing that entire process, I was so inspired that it is such a wonderful thing that you are giving life to a baby and the smile that the lady has on her face. So all that was very inspirational and just so that made me take this field.
As a student, I saw a few doctors while I was a kid, and a few of those doctors were also my inspiration. But then I also felt that there is a big gap in healthcare industry, and healthcare is not as accessible as primary requirements are. So at a very early age, I found that, or I felt that healthcare uh, should be a primary service, and it should be accessible to one and all, not only to the more uh, more fortunate ones or rich ones, or less accessible to poorer ones and less fortunate ones. So that was also one of the things that inspired me to get into this field, and still I still feel that there is a lot to be done to make healthcare accessible to all, and I'm also myself striving towards that direction.
The rewarding moment would be especially amongst couples who are trying to get pregnant. There are so many couples who are trying from 5 years, 6 years, and they would have taken treatments at multiple places and still didn't get the result. So many a times it happens that when they come to me and I take a detailed history, so there are some patients who have undergone IVF and still are unable to get pregnant. So with proper counseling, with proper treatment protocols, and all that, when we give treatment to such couples and when they come with a positive pregnancy test, that is the biggest happiness that I get. And that's what keeps me moving on.
I would say a lot of such cases have been there, and I would say I feel thankful, and I feel obliged to be in this field day in day out. Especially such instances have been increasing after COVID, especially because my branch of medicine and myself are closely related to treating COVID patients, and as we all are aware that it was a very tough time, and I was privileged enough that I could help so many people, and I could make a difference to their life. And that was the time where I had come to so many instances that where I felt that I have taken a correct step, and I have done something good, so that I got a chance to serve so many people and make a difference to their life. I would say uh, uh, I was during COVID times. There was one such instance where the relatives are not allowed, as you know, that the relatives were not allowed to stay with the patients, and while they were struggling with their life, we as doctors were the only people they used to come in close contact with. And I still remember one of my patients who was very critical during his ICU stay, and he conveyed his messages, and he conveyed his words through myself to his relatives who were out at their home. And I still feel that before the patient lost his life, he told me to convey his last words to his family, um, that he loves them so much, and he cares for them so much, and he just does not want to leave them. But it was time for him to leave, and his was time for death, and nothing can make them come together. And that was one of the most striking and most touching moments for me, that I could be a messenger between those patients who are going to die and relatives that were eagerly waiting for them to come back home.
Frankly speaking, being an obstetrician, it is very difficult for any obstetrician to have a work life balance, because emergencies can come anytime. And for us, it's always the patient who are on the first number, and family and friends are always on the second number. There have been so many times that I have gone out with family or friends and we've just ordered our food, and I get a call from the hospital that labor patient is come and she is in active phase, कभी भी डिलीवरी हो सकती है. तो वहीं सब कुछ छोड़ के दौड़ना पड़ता है. तो उस टाइम पे थोड़ा सा बुरा लगता है कि क्या है ये, क्या प्रोफेशन मैंने क्यों ये सिलेक्ट किया. पर जब बाद में डिलीवरी हो जाती है और वो बच्चा जब हाथ में आता है और पेरेंट्स के फेस पे जो स्माइल होती है, वो खुशी कभी भी कोई किसी को नहीं मिल सकती जो हमें मिलती है बीइंग एन ऑब्स्टेट्रिशियन.
Frankly speaking, it's very, very tough for me to maintain that work-life balance. So since last about 3 years, I only take leave once in a year. So I only take leave for about 10 days in a year. So that is especially during Diwali. So I take leave only during Diwali, 10 days to 10 to 15 days of leave during Diwali, and the other 355 days I'm working. So I work on Sundays also. I don't do my OPD on Sundays, but I am available for rounds and our admissions on Sunday. So as I said, I don't take leaves much. It is always tough to maintain that work-life balance, especially to provide a family time. My wife is also a doctor. She's a dentist, and we both practice in the same vicinity. And our timings are also quite similar and working hours. So I start my day at 9 and end it by around 10 in the night. So it becomes really tough to maintain that work-life balance. But then it's also important that you take out time for the family. So weekends, I get a bit time during weekends, and I try to give my quality time to family. But it's a part of our profession, and it is always tough to take out time on any random hours. So yeah, work-life balance is at present it is not that good, but we are trying to get it in line. But for now, it is as a part of our profession, it is very tough.
डॉक्टर्स के लिए खास ये मेरी एडवाइस है, मैं तो करता हूँ, वर्क का बैलेंस करना चाहिए. हम प्रोफेशन में है, कोई भी प्रोफेशन में रहोगे तो आपको डिवोटेशन तो देना ही पड़ेगा, और डॉक्टर के प्रोफेशन में थोड़ा ज्यादा ही देना होता है, क्योंकि हम इंसानों के साथ उनकी ट्रीटमेंट करते हैं, उनकी जिंदगी के साथ हमारा नाता होता है. सो यू हैव टू बैलेंस योर लाइफ. कभी कभी रात को भी जगना पड़ता है, लेकिन ये आपके लिए एक भगवान ने आशीर्वाद दिया हुआ है कि आपको किसी की जान बचानी होती है. तो मेरा तो यही सलाह है ऑल द फ्रेंड्स, ऑल द कलीग्स, कि आप अपने प्रोफेशन में थोड़ा डिवोटेशन दीजिए. आप वैकेशन लीजिए, कोई प्रॉब्लम नहीं है, वैकेशन लेने ही चाहिए, एंजॉय कीजिए. मैं क्रिकेट को ज्यादा एंजॉय करता हूँ, लेकिन उसी टाइम पे आप अपने कलीग्स, आपके असिस्टेंट, किसी को छोड़ के भी जा सकते हैं कि भाई आपकी सर्विसेज डिस्टर्ब ना हो, आपके पेशेंट को तकलीफ ना पड़े. तो हमारा प्रोफेशन है, हम जानते हैं कि हमारे प्रोफेशन में 24 आवर डिवोटेशन देना पड़ता है, लेकिन अगर आप उसको सिस्टमिक तरह से करेंगे तो शायद आप बहुत स्मूथली वर्क कर सकते हैं. असिस्टेंट रखिए, कलीग्स रखिए, और ऐसा करके भी आप कर सकते हो.
So yes, I wish all the doctors and all the healthcare professionals a very happy Doctors' Day. And I know it's tough to be a doctor, and I know it's tough to maintain being a doctor, to maintain the dignity and the standards and the life cycle of a doctor. The stress levels, the efforts, the preparations for the exams, and starting from those preparations to entrance exams, and being a medical professional, practicing as a consultant, and giving out um, professional medical jobs also is tough. I know that it's tough, but at the end of the day, as doctors, I should say that we are making a very huge difference to the lives of people around us, whether they are patients or whether they are healthcare professionals. We are providers, and we provide good health also, and we provide necessities to them also. And keeping that in mind, we should never forget that we are the part of givers of the society, and that should be one of the driving forces to keep going.
A very happy Doctors' Day to all my doctor colleagues and to the new doctors, budding doctors. Let's all of us bring healthcare to a next level.
So happy Doctor's Day to all my dear friends, my colleagues, my seniors, and my juniors. Today is really proud day for all of us. Today is the Doctor's Day. So doctor profession is one of the most important profession of this society. डॉक्टर्स को जो मान मिलता है, डॉक्टर्स को जो सम्मान मिलता है, शायद ही कोई प्रोफेशन को मिलता हो। चैलेंजेस तो रहती है, चैलेंजेस कौन से प्रोफेशन में नहीं है, हर कोई प्रोफेशन में चैलेंजेस है, बट वी हैव टू एंजॉय अवर प्रोफेशन। वी आर अ डॉक्टर, वी आर हियर टू सर्व द सोसाइटी। तो अपने प्रोफेशन पे प्राउड कीजिए, अपने प्रोफेशन को एंजॉय कीजिए। अगेन हैप्पी डॉक्टर्स डे।